Back in 2009, President Obama praised the Cleveland Clinic as a good example of a healthcare system that worked.
Part of what we want to do is to free doctors, patients, hospitals to make decisions based on what's best for patient care. And that's the whole idea behind Mayo. That's the whole idea behind the Cleveland Clinic.
But now the clinic that he once touted as a model for health care is being forced to make some major budget cuts because, in part, of Obamacare. So joining us now to discuss this is Ohio Congressman Bill Johnson. Good morning, Congressman.
Good morning, Allie. How are you?
I'm doing well. It's hard to know exactly what was behind their cuts of $330 million at the Cleveland Clinic because, frankly, their president has said different things. I was supposed to be interviewing him yesterday until he canceled right before our Fox News interview, but he said off camera, "We are not blaming the White House. The cost cutting is comprehensive. Obamacare is just one part." What do you make of the budget cuts they're having to do?
Well, I think this is just another example of what's happening all over the country, Allie, as the president's broken promises hit hospitals all over the country. The Cleveland Clinic is a world-renowned hospital. I mean, people all over my district in eastern and southeastern Ohio depend upon that clinic. My mother and father-in-law both actually get treatment there. But you know, what often happens is as reimbursements are cut, that's one of the first things that go. Reimbursements for Medicare are cut in order to pay for this health care law. Remember, $716 billion came out of Medicare in the health care law, and those cuts mean less reimbursement for health care providers, and that's hurting access. And so these hospitals are having to make some very, very tough decisions to comply with the over 20,000 pages now of regulations that are actually writing the law as we go along. It's a broken promise.
Is it fair to say that even without Obamacare, that there would have had to have been some belt tightening? I mean, we know that costs were spiraling out of control with health care well before Obamacare. Now, what's interesting is that the president said that it was because of those spiraling health care costs, and that's what Obamacare would help fix, but it doesn't seem as though that's working for the Cleveland Clinic.
Well, we have always acknowledged, and Americans all over the country acknowledge, that health care reform is very needed. It's just not a federal takeover of health care because doctors and patients and good hospitals like the Cleveland Clinic know a lot more about how to provide quality health care than unelected bureaucrats in Washington, D.C. There are plans that we have in the Republican-led House to put patient-centered solutions in place, but as you well know, Allie, we've gotten no cooperation from the Senate in order to do that.
It is a tough one. Bill Johnson, thanks so much for joining us this morning.
Thank you, Allie.